Okay.
What would you like me to say?
I don't know.
If you're not here, you should be.
Topic.
Is ACEs, Adverse Childhood Experiences.
Okay, that's all I'm asking. Presentation on pieces.
Yeah.
Please excuse the interruption. Our first speaker is getting ready to begin in the auditorium. The presentation will be on ACEs, Adverse Childhood Experiences. Please attend or watch the live stream. Have a great day.
I wonder if he's going to come back and let me know if the camera's on. Is it on? What? Is what up there? No, there's nobody upstairs. Okay. Thank you for joining me this evening on this session of the educational component during conferences. I am going to be speaking about mental health. It's what I do. It's pretty much my life. I have been doing mental health now for just about 2 years. Prior to that, I did family practice for several years. Recently, now just in March, I'm back here in Sibley 4 days a week, which is great because the last several months I was kind of in between here in Sioux Center for providing behavioral health services. So I'm really excited to be back. I was here this fall as well, talked a little bit about the services. So for those of you who are listening or watching or whatever who don't know who I am, I'm Tasha Jennings. I am a psych nurse practitioner. I also am dually certified in family practice, as that was what I did initially. I'm from Sheldon originally. I live in Sanborn. And I've worked up here in Sibley now since 2017. I worked at the clinic first, and then when I got my postmaster's in psychiatry, I started working at the hospital providing mental health services. So in the fall, I talked just basically about mental health, depression, suicide, because those are big things that have been occurring in the community and a very prevalent factor when people are presenting to the clinics. Now, not that the depression and suicide things are lessening, but we are starting to get a lot more children and even adults coming in dealing with things that probably occurred and started to occur in childhood, which is where it brings us to our topic tonight of adverse childhood experiences. This is a very important topic because as parents and grandparents, it all starts at home. We all want the best things for our children, and we want them to grow up and to be healthy kids and interactive kids and be able to handle normal life stressors. But how that happens is based off of the things that we do at home first with them. So adverse childhood experiences is anything that can happen to a child between the ages of 0 and 17, essentially, that is adverse. So some of it is the obvious things like abuse, so neglect and physical, emotional, sexual types of abuse. Other things are family dynamics. So if you live at home with somebody who was or is still struggling with substance abuse, whether it's drugs or alcohol, dealing with other people who have mental health diagnoses that are probably not managed. So parents or aunts and uncles that maybe have bipolar or schizophrenia, or even have some psychosis, can really have some negative impacts. Also having interactions or dealing with racism at school. We like to think that around here in Northwest Iowa, that's not really a huge issue, and it doesn't always, but there are things that do come up that deal with racism. Also dealing with divorce. Divorce is something that's quite prevalent these days, and for the most part, most of us feel like we adjust well to it, but there's a huge population of children that are experiencing divorce with their parents that is not great at home. A lot of the times it's because there could be abuse at home, there could be addiction at home, there could be unemployment at home, all sorts of different things. So being aware of the different things that happen in our every day-to-day life does impact our children. When you as an adult think back to the things in your childhood and the things that you experienced, a lot of times I hear parents say, well, I dealt with it, or the same thing happened to me, why would it be any different? Well, you also have to remember that if you were dealing with a physically abusive parent while you were growing up, you may think to yourself, I don't want to do this to my child, which is great, and that's good. But there are things that people tend to bring with them, and you may not be physically abusive to that child, but you could be emotionally without necessarily knowing it. We can be thinking that we're offering constructive criticism to our children, but when it comes out as, well, why can't you just do it this way? Or why did you do it that way? Well, that was dumb. Those types of things impact our children. When they are young, we have to remember that they're still kids. So there's things that they don't know and they don't understand, and it's going to take time for them to learn. So we have to be patient with them. You cannot expect a 5-year-old to know how to do the dishes, and you cannot expect that 5-year-old to know how to do the dishes every night after you showed them once. So it's different things like that that really start to impact our kids. When we think of our adverse childhood reactions, the alarming part is that over 60% of adults have experienced at least one adverse childhood event in their life, whether that is abuse, neglect, divorce, anything. And then 17% of people have had 4 or more adverse events happen to them. And when you think of that, when we think of 4 different events, it can be alarming to some people because you don't think that it's that common, but it is. And the people who were surveyed, out of that 17% that had 4, the majority of them were women and people of minorities. And that is something that we really should be focusing on, because that is our big population. We get males in all the time with different things that are going on in their lives, but typically it's our women, minorities, and children that are coming in that are dealing with big things and they don't know how to deal with it. ACEs can have a long-lasting impact on not only our mental health, but our physical health. They can cause cardiac issues, respiratory issues. We can have high blood pressure, those types of things. And by just reducing ACEs, being aware of them and putting in preventative strategies, help us lower those risks. So some of the stuff is like if we are having repeated stress, parents argue all the time at home. There's yelling and screaming going on. In our brains, and it's in everybody's brain, it is normal for us to release our fight or flight endorphins. Well, what happens with that is that if you constantly live in a state of stress, your body then doesn't know what it's like to not be that way. So when that raises, that increases all these other inflammatory markers and different things in our body that then will negatively impact our organs, which then plays a role on our heart, our kidneys, our stomach. A lot of the times people who have high anxiety also have issues with their gut. That's typically the number one thing. People are like, oh, I'm constipated or my stomach hurts all the time. I need to puke. I feel nauseous, all of these things. And 9 times out of 10, it's because it's an elevated amount of anxiety, but they don't know where it's coming from because what they're living in has been normal for them. And it's not actually normal for our body to always live in that. So when we don't make these changes or are not recognizing these things in our children, they follow them into adulthood and they follow with our physical issues. They can follow with other mental health issues like anorexia. We can become quite recluse. We can become quite depressed with all of these things. Preventing them can actually do the healthcare system a huge service. There's reduced costs to many different areas, cardiac, respiratory, and GI type of things. We could, according to the studies that CDC has up on their websites, it shows that preventing ACEs could potentially reduce cardiac diseases by 1.9 million people. That is huge. And it can also reduce 21 million depression cases. And when we think of that, as depression seems to be one of the biggest things that we see, if people are able to handle and do the right things and have the right things in place at an earlier time for our children, they don't have to grow up to be depressed adults. They don't have to grow up thinking that nothing that they do is good enough. It's not just as simple as just like, well, just be happy. It's not that simple, and it takes a lot of time. There are different things that we can do just besides it being an individual problem. Of course, I always stress with people that it starts at home. It is so very important with your little kids that, and through 4th grade, also going up to high school, it is so important for you to give them positive feedback. Children don't know that they're doing the right thing unless you tell them that they're doing the right thing. And when you tell them that and you're excited about it and you're happy for them, that releases feel-good hormones and a response that says, oh, this is good, so I'm going to do it again. When I do this, my parents are like this. So even small things like when a child gets toilet trained, good job, great. Yes, you're probably going to have to do that for a few months because children thrive on positive responses. When they learn how to ride their bike, that is a big deal to kids. Be excited with them. Get into their life and into their mindset. It is very normal for us as parents to have rules, and that's great. We should have rules. We should have expectations of our children and expectations of our family that keeps people safe. Don't run in the road. Look both ways before you cross the street. Don't talk to strangers. Those types of things. But we need to make sure that when we're telling kids about things in house, like don't touch the knives, obviously, if your voice is loud, they are going to respond. But when your voice raises and you are hollering at your child, it also releases emotions and endorphins in our brain, neurotransmitters, all of those things that actually shut down responses. And children then, they're not hearing you say, no, don't do this, don't jump on the couch, don't run around, don't hit your brother. It's like it's not registering, which is why a lot of the times we're hearing more and more evidence about the benefits of when you're correcting your child to have a calm voice. And a lot of people are like, well, my parents yelled at me and look at me, I did it. Nah. Well, yes, but you did it out of fear because you didn't want to be yelled at. When you approach a child about not hitting their sibling and you are calm and rational about it, now you should not hit your sister because that hurts and you don't like it when somebody else hits you because you hurt. They connect those things. Yes, you are going to have to do it more than once. You are probably going to have to do it much of their entire life, but you will start to see positive responses and less acting out. If you react to a child's behavior that mimics what they're doing, so if a child is screaming and is angry and is throwing things around the house and they're just throwing a huge fit, and now this can be any age because it happens with our high school students as much as our elementary students, if you respond that same way by screaming back at them, knock it off, it's not going to fix anything, because then they are learning that that is an appropriate response when they can't figure something out or when they're struggling with something. So if you want your children to respond appropriately in a situation such as their toy broke or they were working on a school project and their younger sibling spilled juice all over it and it's a huge mess, we all know that we should not have this huge reaction and fly off the handle and yell and scream and throw things. But if your child does that, the best way to approach them is to be like, okay, take a minute, breathe through this, think about it, and once you have settled through all of it, let's talk about it so we can figure out what we can do, because we can't change this anymore. Because in actuality, as adults, that's the same thing we have to do. We, got to work late. We're gonna come in and we're gonna clock in and our boss is going to be upset with us. And we can't change what already happened. Not saying that it's okay for you to continue to do it, but telling your boss, well, my kids did this and my kids do this, that's not really helping the situation. But if you tell them, yes, I know that I was late, let me work on this, let me do better the next time. That's the best part, is that you can do better the next time. And that's what we need to do with our children. Every day we're not going to be perfect parents. Every day we're not going to be perfect educators, but each day we can do better than the day we did before. So always remember that even in our times where we think that maybe we're not doing the best that we can, you're doing the best that you can in that moment. So don't get so hard on yourself. Different things, community support can be super huge when it comes to adverse childhood experiences. We do tend to keep our family lives private because we don't want other people to know about them, which is good. But if you notice that another child might be experiencing something or reacting to a situation that you're like, whoa, what's happening? It's important for you to interact with them in that positive way so they can see that there's another way to handle the emotions that they are having. Some kids don't know any different and they just do what they do because it's normal. So just as educators and parents, when we're seeing those different things in our classrooms or at sporting events or even at the park, if a child is acting completely and totally irrational, they probably don't know any other way to do it. So instead of looking the other way, we can approach them in a like, okay, let's talk about this. Let's figure this out. We'll let you calm down and then address it. Kids do start to learn those things. Some of the other stuff we can just, intervention is of course always the biggest thing. One thing, and people tend to have a little bit of a harder time with this, is doing just family therapy, because we all think that I don't need somebody else to tell me what to do. I know what I'm doing. But in actuality, when you stop and you think about how you approach different situations, if your child is struggling with something, we're there to support them. We are there to help them through that, not to point out the things that they're doing wrong. So if you are being positive with them and interacting with them at that level, we can get those examples by doing therapy. You don't have to do it every week for a year. There does not have to be a huge thing in your life that's occurring. Maybe you just were never taught the good way to have a relationship with your child. Therapy can be very beneficial for that. Of course, access is a big thing. There are, of course, limited access in our county here in Osceola for therapy services. We have one, which is Amanda Tenaple here in town, and that's it. We do have some services that travel around. So we have Season Center that is quite helpful, and they come to the schools here, and they come to a lot of the schools in our communities. But to have an actual therapist and working on some of those things, when you only have one therapist, that person can't possibly serve the entire community. So unfortunately, we do have to go outside of our community. There are places in Spirit Lake, there are places in Sheldon, there are places in Sioux Center. Most parents are typically quite understanding about that. When you come to my office to see me, we try to do everything in our power to help them, because I don't feel that anybody deserves to not get the care that they need. Early education at school. So I know that our teachers are already doing a good job at this, but teaching children how to express their emotions, what happy is, what sadness is, what angry is, and how to be angry and not be aggressive, those types of things. Of course, it's great that school's teaching it, but it also is our responsibility at home to do it. We are still parents, we are still responsible for the behaviors of our children, and it's important that we are steadfast with them and have those types of expectations, because if they don't do it with us, they are not going to do it with other people. So the biggest thing is raising awareness, talking about it, understanding that ACEs happen in all situations. They happen in all families. They happen in all communities. It's not just those people. Anybody can deal with alcoholism in their family. Anybody can deal with sexual abuse in their family. Anybody can deal with being in the foster care system because of choices that parents have made. It is not discriminatory. Yes, there are some populations that experience it more often, but we can break that cycle. I encourage everybody to take a very active role in your parenting, in making sure that you're talking with your kids about things, whether it's what they did at school or maybe what they encountered on the playground, or just be interested, because when you're interested in what your kids are saying, they tell you things. They don't necessarily want you to say, well, you should have done this. They kind of just want to tell you what's happening, and they just want you to be an ear. So it's okay to just sit there and be like, yes, I can understand why you were upset. Validate their feelings. You don't have to fix it for them, because you don't have to fix it for them. Children can fix those things, and most of the time, the next day, they're gonna be over it anyways. So, I do have handouts. I'm going to leave some at the high school office, and it talks about ACEs, Adverse Childhood Experiences. It has our office contact information as well, so you can always reach out to my office. You can reach out to the family practice clinic. You can just reach out to somebody here at the school, and they can get you connected and hooked up with the people to help you.
It is on. Can you hear me? I think it's on. I think that's for the live stream though, I don't know. Because I'm too dependent on screens, but I don't have everything memorized. The name on.
Yeah, it's live right now.
Okay. I'm gonna go see if Stan has it almost done. I'll go fast, hopefully. I have a PowerPoint, but we'll see if that's done. Real quick. Right. Well, I mean, no. But I don't even know now. Oh, sorry. Well, I don't know if they do that in the PowerPoints, and so I don't know. I emailed it to Stan, and so he would.
Did I send one back? Yes. Okay, you're gonna try to answer questions. I will try, yes, okay, I was like, did I hit send? Yeah. Or did I just think about what I was gonna write and not? Yeah. Anytime. I'm not losing it, I just need to. I'm crazy busy. Yeah. But, yeah. Anytime. I'm looking for perspectives. Wouldn't that be a good idea? I would love that job. Organizing and like. I have my real job that I want to do all picked out. I just don't have a husband. So now 2 weeks is what I'm gonna do. That's what I was.
Best I can. Sorry for any confusion there.
That's all right. That's all right.
Gotcha.
Is there a clicker or something, or just need to thumb through?
Yeah, that's what others have done.
Okay, that works. Do I need to talk into the mic, or is it?
Yeah, so with the live feed,
Okay.
the live stream, that helps project it so it's picked up there.
Yeah, because they won't hear it.
Sounds good.
They won't hear it otherwise. And the speaker before you did not have a presentation, she just spoke, so.
No, I'm
View slideshow. You want it down there, up here?
yeah, that's up there's fine. Yep, that works.
Now I'll shut off the house lights here to
Perfect.
make that a little easier to see.
All right.
Okay,
Cool. Thank you.
sorry about that.
Nope, no problem. No problem. Well, we can just get started then. So looks good to me. Sounds good. So thanks everyone for coming. I'm Dr. Sterk. Just talking about screens and kids especially today. I did do a presentation over at the hospital last fall. It was a little more in-depth, so this is kind of reformatted from this. So if you do want more details in general, that would be a good resource. I think it is on the hospital Facebook page. You might have to search for it. But so this is just going to be a few statements to get a little interaction. I am going to ask for some audience participation. So true or false to these statements, and there is a wrong answer, but there's no points for getting it right or wrong. So this statement, the average American spends 3.5 hours per day on their smartphone. This is not just kids, this is all people. True or false? True, true, true. False. Okay, so that is true. That is true. It's about 46% of people use their smartphone between 4 to 5 hours per day. So that is the average at 3.5 though, which means if you use your phone for about 2 hours, that means somebody's probably using it for, what would that be? Yeah, 5 hours or so. Individuals check their phone an average of 58 times per day. So that's every time you pick up your phone because you think you have a ding from your phone, or you think you had a ding. This is a chart looking at internet usage between 2011 and 2021. And actually, interestingly, we don't use more internet on a computer than we did 10 years ago, but we use 5 times as much on our phones. So we went from 32 to 155 minutes just on our phones for internet. No, okay, true or false? About 65% of children will have a cell phone by age 10. All right, that one is false. Currently anyway, in 2 years it might change, but right now it's about 40%. This is another table looking at not who owns a cell phone, but use. So the interesting thing I thought here was on the first line right in the middle, smartphone use for 0 to 2 years old is about 50%, 49%. So that means, I don't know how much use that is. They didn't clarify in this chart, but the fact that 0 to 2-year-olds are getting lots of smartphone use is a bit concerning to me. True or false? 75% of Gen Z say they use their phone too much. True? Yep, that one's true, which is interesting because, yeah, here's a chart on generational breakdown. So the bottom line is Gen Z, so about 75% say they use it more than they would like. Interestingly, baby boomers, who you wouldn't think are into their cell phones as much, they're still about 50% saying that they use it too much. So, main reason people use social media is because they are bored. True or false? True? Yep, that one's true. About 52% in one study showed that. Other things would be, obviously we can think of other uses of smartphones, but that was the main one, which is, again, a bit concerning. Okay. Screens are not addicting. True or false? False. Okay, that is false, yeah. This is a quick little chart here, or a picture of the brain, and just talking about the dopamine pathways. So dopamine is your feel-good hormone. So if you eat a piece of chocolate or you have something that is pleasurable, you get a little bit of a dopamine released. When you are on your phone, or more so on a phone than a TV, you have a new bit of information that comes through. So your text message, your notification goes off. Ding, you look at your phone, boom, that's a hit of dopamine because it's new information. You have, you're scrolling on your social media feed, and every time you scroll, it's another hit, another hit, another hit. And the other thing that is interesting about this is this quote: the brain strengthens pathways it uses. So the more you do something, the more your brain strengthens that, almost like a muscle. You're strengthening your muscles. And so the more often you're doing that, the more that neural pathway gets solidified, and that is what leads to the addiction, because then it's harder to break off of that. So interestingly, this is the same pathway that is used in drug addiction, in alcohol addiction, and other types of addiction. It's the same reward system feedback loop. All right, video games can help my child develop hand-eye coordination and visual spatial skills. True or false? Of course, you guys are saying true. That is true, actually. Likely true. It also can improve reaction time. So there is not zero benefit from video games. The argument or the question is does the benefit outweigh any negative effects? And so this is the next one. There are several studies showing brain MRI changes with video game use. True or false? True, yeah. I'm not making these too hard, I guess. It is true. There have actually been a couple different studies. So one, Indiana University did a study with violent video games, and they showed functional MRI, so that's the one where the brain lights up, the certain areas of the brain that are being used. They showed it changed from baseline just after 1 week of violent video games in people who didn't play video games normally. So yeah, just in a very short time. There was another study as well, in 2008 from UCLA, which was more with internet use. And they showed that people who did not use the internet at all looked the same as people who did all the time, just with 5 hours in the course of a 5-day period of internet use. Like they had the same changes of their brain in certain pathways. And interestingly, in the Indiana University, those parts of the brain that were changed were the ones that, one, are associated with addiction, the dopamine pathways, and then two, associated with inhibition, or the ability to say, I'm not going to do something irrational. So it is quite interesting and, again, concerning. All right, for my child to learn most effectively, he or she must have the latest technology. True or false? We got the teacher saying false. Yeah, I don't see, from all my research of this, I did not see any evidence that it helps necessarily. So a couple different things. They had a study in the United Kingdom. They banned phones in schools and test scores improved by 6.4%. 2010 Duke study, they saw that home computers negatively impacted reading and math scores. And then elementary kids with greater than 2 hours of screen time per day are more likely to have social, emotional, and attention issues. Oh, there's a long one. Technology changes fast. There are lots of good jobs within the tech industry. I want my child to have the latest technology so they don't get behind in life. Is that a true statement, or do you buy that statement or not? False. Good man. Good man. Yeah, it is false. Yeah, so kind of what we talked about before, technology actually can inhibit learning more than it helps. My advice would be to delay the technology, learn real skills, communication skills, learn functional skills, and then you can implement the technology. I mean, most of us didn't grow up with the technology we have today, and yet we pick it up easily enough. Technology changes fast, but it's not hard to pick up when that is part of your job. And interestingly, Steve Jobs, the founder of Apple, and other Silicon Valley executives, the big tech people, they send their children to tech-free schools because they understand the effects of these screens and what they do to the developing child. All right, picking on social media now. Social media is good for my child. It helps them connect with peers and form better relationships. True, false. You guys are too good at this. I made it too easy, I think. So yeah, that is false. There are multiple issues with social media, especially in children. So yeah, bullying, that's an obvious one. I'm sure the school has had to deal with things like that in the past. Social comparison, so you go on Facebook and you see, wow, this person has such a perfect life. Look at their family, they look so perfect, and they are showing a very small glimmer, a souped up glimmer of what their life is truly like, but then you think, I feel worse because my life isn't that good. Facebook's emotional consequence study, so this was a study that Facebook actually did on their own, and this was not Facebook's study, but this study found that the longer you spent on Facebook, the more time on Facebook, the more negative your mood was afterward, likely due to this social comparison. And the other thought is due to productivity with your time. If you go on Facebook for half an hour and then you get done, you're like, oh, I just spent a half an hour on Facebook. What have I done with my life? Like, that time was, in essence, wasted. Not necessarily, of course, and that was compared to internet usage, so not even compared to, doing something productive like doing homework, or that was compared to being on the internet and doing something else on the internet. They felt worse. There was an Instagram internal study that actually showed that being on Instagram increased suicidal thoughts and eating disorders in children, or in teenage girls. They, of course, didn't come out with that very publicly until a whistleblower let that out, but it turns out that Facebook and Instagram might be more interested in making money than on helping teenage girls. But the algorithms that they set are set to be as addicting as possible. So the things that give you what is the next thing on your Facebook feed when you scroll, oh, now it showed my cousin said this, or now it showed whoever, another picture or another YouTube video. Those are set to be as addicting as possible, and also to increase the emotional response. So that's why so many things become polarized, because you see something that, you know, as a good old Republican, you see something that makes you infuriated, and then it keeps feeding you more and more and more of that. So we get more and more polarized as time goes on, a lot due to this. All right, screens have the same effects on kids as they do adults. True or false? False. We got some falses and some trues. Mostly false. When it comes to the addiction and those sorts of things, adults can be affected just as much. The difference is children's brains are not hardwired. They have not fully developed their brain enough so that it does affect them more. This is a picture of a nerve cell in the brain, and the wrapping around the kind of thing that looks like insulation on a wire, that's called myelin or Schwann cells, and that basically leads to faster transmission. That is being developed in children. And so if you are, think about the brain strengthens the pathways it uses. If you're using those pathways more and more in children, that becomes essentially hardwired, where these become the main pathways. So that's one aspect of it, is since they are developing, those are the skills that will carry with them throughout the rest of their life. Also, because of the quick, fleeting nature of screens and being on phones and how the attention span, I think there was a statistic, I didn't put it in here, but the average amount of time spent on an internet page, and this was a computer, so before a phone, was about 17 seconds. So there's no deep reading that's going on. So this leads to, for children, aversion to challenges. If you don't like what you see, you scroll. If you get stuck in a video game, you just turn it off and restart it. Loss of resilience, you become more impatient, and loss of imagination. Everything is laid out in front of you, so you don't have the ability, or don't develop the ability to think about things that be creative and things like that.